Hello, this is Dr. Joe Garri from Mosa Plastic Surgery. Welcome to episode number 12 of the Surgeon's Corner podcast. Our topic of discussion for this episode is a procedure commonly known as a facelift, which in medical jargon is referred to as a rhytidectomy or myeloplasty. The process of facial aging is universal in that it happens to all of us. It results from a combination of loss of skin elasticity, shifting or loss of facial volume, and a degradation of the integrity of the deeper tissues of the face, which result in a radial or outward expansion of the facial width. This combination of undesirable changes can be accelerated or aggravated by detrimental compounding factors such as sun exposure, smoking, or poor dietary and skincare habits. The aesthetic, youthful face has a heart-shaped configuration with most of its volume located superiorly, usually around the cheekbone area. The skin of a youthful face is smooth and closely adheres to the facial skeleton, creating smooth, flowing curves and a seemingly transition from one facial subunit to another, as for example, the transition of the lower eyelid to the cheek, which in older patients can be demarcated by a deep trough. Other typical characteristics include prominent cheekbones with a subtle cheek hollow, a clearly demarcated jawline, and a sharply defined cervicomental angle, which is the angle created by the neck and the tissue under the chin. Facial aging is commonly first noticed around the neck with a development of laxity of the tissues under the chin, creating a gradual loss in the definition of the cervicomental angle and excess skin in the neck. Loss of skin elasticity leads to the development of wrinkles throughout the face, as well as deep creases, as those seen next to the upper lip, known as the nasolabial creases, or those seen just lateral and inferior to the lower lip, known as the marionette lines. Sometimes these two creases join and form one long crease, creating the parentheses type configuration around the mouth. Shifting and/or loss of volume of the compartments of the face leads to an overall migration of facial volume inferiorly, changing the overall shape of the face from heart-shaped, with most of the volume being around the cheekbones, to a pyramidal configuration where most of the volume is located in the lower face and neck. Moreover, the degradation in the integrity of the deeper tissues of the face and the radial expansion it causes can lead to the appearance of unsightly facial bulging, such as the jowls, for example, which are located lateral and inferior to the lower lip. Jowls obscure the jawline and, when severe, can extend into the neck area. A facelift is a cosmetic surgical procedure which has the specific aim of reducing or ameliorating the signs of facial aging previously described. A secondary goal is to provide for a better distribution of facial volume and create a seamless transition from one subunit of the face to the next. The terminology regarding facelift surgery can be somewhat confusing. Thus, it is important to understand some of the key nomenclature involved. Although the neck can be addressed independently by a procedure called a neck lift, the traditional or classical facelift procedure addresses both the neck and the face in one comprehensive operation. A facelift, by definition, does not address other areas of the face, such as the brow, the eyelids, or the nose, for example. These areas are treated with other specific operations, such as a brow lift, blepharoplasty, or a rhinoplasty, all of which have already been discussed in separate podcasts in this series. Although these are distinct, separate operations in their own right, when indicated, they can also be incorporated and performed in the same time as a facelift. For younger patients with minimal to moderate signs of facial aging, a distinct procedure called the mid-facelift only addresses the aging changes around the cheekbones and the tissues of the cheeks under the eyes associated with mid-face descent. This particular procedure will be the subject of a separate future podcast. In this specific podcast, however, we will discuss the facelift as it is universally understood, and which addresses age-related changes in both the face and the neck. Facelifts are usually performed in an operating room setting with general anesthesia or monitored IV sedation. An overnight stay at the surgery center or in a monitored setting is recommended, as the operation is somewhat detailed and can take up to several hours to complete. particularly if secondary procedures such as brow lift or blepharoplasties are performed concurrently. The facelift operation uses strategically camouflaged incisions in the skin of the face and the neck to access the deeper tissues, which are a key component of this operation. The configuration of the skin incision itself can vary depending upon the amount of excess skin involved, but commonly starts in the area of the scalp just above the ear and extends in front of the ear, around the earlobe, and onto the posterior aspect of the ear. From there, the incision turns inferiorly and continues onto the hair-bearing area of the posterior scalp. If a neck incision is required, it is usually made on or close to the crease located under the chin, which is called a submental crease. The facelift procedure is not a skin-only operation, but rather involves the manipulation of the tissues deep to the skin, particularly the fibrous tissue plane of the face called the mass, which extends into and is continuous with a muscle layer of the neck called the platysma. This tissue plane is important as it is a fibrous and muscle layer which can hold tension via sutures. It is the manipulation and tension created in this layer that results in the facial volume shift and turgor necessary to surgically create the lifting effect used to reverse age-related changes of the face. Placing the surgical tension on this layer rather than the skin leads to a natural and yet youthful appearance after a facelift, rather than the tense, windswept, swept look of some facelift techniques that place undue tension on the skin. Tension causes skin to stretch over time and can result in an unnatural stretch appearance after a facelift that depends on skin tension. Skin-only facelifts are known for underwhelming, short-lasting results. There are multiple techniques as to how this deep tissue of the face and neck can be surgically manipulated. When this tissue plane is dissected as a separate layer, the technique used is said to be a deep plane technique, of which there are several variations. This deep plane term, as it refers to technique, is to be differentiated from what is currently referred to as a deep plane facelift, which refers to one distinct variation of the deep plane technique. No matter the specific technique used, once the deep tissue plane is manipulated and sutured into place, the skin is then overlapped over the prior incisions and the excess skin is removed. The skin closure is then performed without any tension as to optimize results and minimize scar widening and the windswept, stretched look. As per the surgeon's preference, sometimes drains and/or a snug-faced or neck dressing is applied. As previously mentioned, although a facelift can be performed as a standalone procedure, it can also be done in conjunction with other complementary procedures, such as a brow lift, blepharoplasties, or non-surgical procedures such as fat grafting or skin treatments, be it dermabrasion, laser, or peels. As with any operation, complications are always possible. One complication that particularly pertains to facelifts involves potential injury to the nerves responsible for facial movement. Thankfully, these injuries are uncommon, and when they do occur, are usually temporary. Another significant concern is bleeding under the skin flaps, creating a hematoma, which sometimes can require a repeat trip to the operating room for evacuation and management. These hematomas can occur up to 2 weeks after surgery, and meticulous intraoperative technique and blood pressure control during and after the surgery are critical in their prevention. Necrosis, or skin flap tissue death, has also been reported after facelifts, particularly in patients who smoke. Thus, most surgeons insist that patients stop smoking for at least 3 to 6 months prior to undergoing a facelift. A facelift procedure is usually not painful per se. Rather than pain, patients usually express a sensation of tightness or stiffness, particularly while turning their head to the side. There can be associated swelling and bruising that can take up to 2 weeks or more to resolve. The drains and sutures are usually removed within the first week after surgery. Recovery takes about 2 weeks, although strenuous physical activity should not be resumed before 6 weeks. It is recommended that red carpet type appearances, presentations, or significant personal events such as birthday celebrations or weddings take place at least 3 months after facelift surgery so as to avoid any stigmata of the procedure, such as fresh healing scars, residual swelling, etc. A question patients commonly ask regarding facelifts relates as to how long they last. In my opinion, the best way to answer that question is to explain that although a facelift sets the clock back and makes one look years younger, the aging process cannot be stopped and will continue as before. However, it has been my personal experience that after a well-done facelift, patients don't think in terms of having another subsequent facelift until 10 to 15 years after the first operation. In conclusion, a facelift is an excellent surgical option to comprehensively address face and neck aging. A well-done facelift can result in much improved facial volume distribution and contours, a well-defined jawline, and a much sharper chin-neck angle. Moreover, it can greatly improve facial wrinkles and lead to a smoother, healthier appearing skin. Overall, this constellation of improvements can lead to someone looking years or even decades younger than prior to the operation. Thank you very much for your time and attention. I'll see you in the next episode of the Surgeon's Corner podcast.